thank everyone for attending tonight's virtual session, where we are going to talk about designing and implementing a trauma-informed content strategy for the City of Philadelphia's Office of Homeless Services. Before I go any further, can everyone hear me okay? If no, just put a little note in the chat now and we'll try and troubleshoot before we get too far. Okay. And I'm also going to have Tamar turn on the closed captions, just in case there are people who need closed captioning for the evening. All right. Okay. So again, thank you so much. Just to begin, about who we are, a little bit about who we are. I'm Arin Black again. I worked at the Office of Open Data and Digital Transformation with Clare and Tamar, and I am now a delivery manager at Nava PBC, and I'm gonna let Tamar and Clare quickly introduce themselves as well.
Hi, I'm Tamar Fox. I'm a senior content strategist also at Nava PBC. I worked for the city as a content strategist from 2016 to 2019. Before that, I worked in nonprofit communications and fundraising, and I'm really excited to be here.
And I'm Clare Cotugno. I'm a senior content strategist at Think. I was with the city from 2017 to 2019. In my last life, I was a professor of English, and I am and remain a lover of dogs.
As do we all. So who we are in terms, though, of the project is really, we're a very small part of a much larger team. It's really important to note that we couldn't have done this work unless we had been brought into a much larger project. And so we were really honored to work on this effort as part of the PHL Participatory Design Lab under the direction of Leanna Dragaman and with service designer Devika Menon. And so we just contributed a content strategy to a much larger project. And that project, if we could go to the next slide, really asked this question. What does trauma-informed service delivery look like for participants and staff who interact with OHS across 3 service components? And that's process, information, and space. And so our project really looked at the information component. So you may be asking, well, how is information a service when considering the offerings of the Office of Homeless Services, right? It's really big and serious things that they're dealing with. So why is information important? How can that be helpful in trying to assist people as they are navigating this system? Oh, there we go. Next slide. So really, to understand, I think it's valuable for us to just briefly explain a bit more about OHS's services for those at risk of experiencing homelessness or those who are experiencing homelessness. So in 2018, it's really valuable to note that about 7,500 households visited an access point. And so what I mean when I say access point is when residents in Philadelphia are either experiencing homelessness or at risk of experiencing homelessness, they visit one of 3 centers known as access point to get services. So again, in 2018, about 7,500 households visited one of these access points. About half of that number received emergency housing, and about 800 households were given some form of financial assistance, also known as prevention funds, to prevent homelessness and the need to going into shelter. Those households really represent single men and women, women with children, families, couples, the old and young, and each one of those households comes to an access point in a state of need. So that means that many people who arrive at an OHS access point are in a very vulnerable state. So they might be fleeing domestic violence or have slept in their car for a week. They may have been kicked out of their homes. And when they get to an access point, They unfortunately don't just walk in the door and get a bed or prevention funds right away. First, they have to navigate paperwork and processes that can sometimes be opaque, confusing, or overwhelming. Oh, I think we might have missed one slide. There we go. And just again, the access points themselves, really, it's important to note there are 3 of them, but they themselves can be frightening or difficult to navigate. One in particular, the Apple Tree Family Center, has a number of long, narrow hallways and locking doors. Service accesses within the building are spread across 3 floors. No matter which access point you go to, you have to put your belongings through security scans. The spaces can sometimes be loud. Yet inside each of these sometimes overwhelming spaces, residents are asked to fill out paperwork or verbally provide information that could be critical to their getting the help that they need. So that, no doubt, can all be very traumatic. And what do we know about how the brain processes information in high stress or traumatic situations? Well, here we are on a Zoom call, and think about your own experience these last few weeks. Or even imagine a time when you had a stressful project at work where you were expected to make decisions when information was either incomplete or overwhelming. Think about a trauma you experienced and how well you understood or remembered the details. It's difficult in times of trauma to process information. And residents who come to an OHS access point, no matter the reason, are doing so within the boundaries of trauma. In addition, staff working within OHS also experience secondary trauma. Each day they have to take in difficult stories, deal with a range of emotions, handle health issues, substance abuse, violence, and they do this within a system that does not have enough resources to help everyone right away. I mean, as much as they want to help, the fact is there's no guarantee that those in need of emergency shelter will get a bed the first night they come. Residents sometimes have to wait weeks for more long-term transitional housing to become available. So the people at OHS who are dedicated and committing to help have to also navigate this environment, and helping in these circumstances comes with its own trauma. So within the service environment of prevention, diversion, and intake, both participants and staff are experiencing trauma. And we recognize that our brain experiencing trauma has a harder time processing information, that unclear information can be a barrier to service access. And we want to be able to provide service access. So recognizing this, we need to be intentional about how we provide and ask for information in order to be most effective in delivering services. And that's where Tamar, Clare, and I came in working with the larger OHS team. And Clare is going to talk a little bit more about what we did.
So we rolled up our sleeves and came up with a trauma-informed content strategy, which we call information as a service, because the information itself, giving out the right information, is a service unto itself. And it requires a strategy, a content strategy, as a matter of fact. Next slide. So this is the last place I probably need this slide. However, what is a content strategy? We define content strategy as getting the right content to the right user at the right time. And if you think about the scenario that Arin has just painted for you, you could see that it could be a difficult challenge. Next. When we say content, we're of course, and especially in this case, we're talking about a lot of different forms: printed instructions, flyers, brochures, forms, lots of forms, signs, images, videos, web copy, and even outgoing phone messages were all among the content that we audited. And we borrowed from SAMHSA to come up with to use their 4 R's, realize the impact that trauma has had on the service system. Recognize the signs of trauma in service participants, staff, and leaders. Respond by designing trauma-informed policies, services, and service materials. Through these 3 R's, we can resist re-traumatizing, right? Because that's the big risk here. Folks have come into an access center looking for help. The access center is not ideal, and it'd be very easy to re-traumatize them. But if we work against that, if we use those 3 R's, we're working toward collective well-being of the participants, the staff, and everyone involved in prevention, diversion, and intake. We asked ourselves, what is trauma-informed content? And we came up with a list. Trauma-informed content is in plain language. Again, remember, people are having a hard time absorbing information, so it's even more important than usual for stuff to be in plain language. It's truthful, it's respectful, it explains why. Why are you telling me this? Why do I have to do this? It's consistent across channels. What I learn on your website needs to be the same thing I see in the flyer that you give me. Otherwise, I'm going to get worried. And supports wayfinding. For us, that meant that the access centers are not designed for the purpose that they're being used for, right? One they're older buildings. One of them is 3 stories with winding corridors. So it's easy to get lost or to feel like you're about to get lost. So our trauma-informed content, one of the keys we had was it has to support wayfinding. Next slide. So let me talk a bit about our process. But before I jump into that, let me add that this is made possible by work of the service design team, the researchers. There was a lot of relationship building that went in, a lot of synthesis of different information that we got from different parties, which produced insights. And so this is all the product of many people's work, not just ours. We ourselves interviewed frontline staff at OHS, administrative staff. We interviewed participants in the system. We had meetings sharing our approach and the why before we began work. In other words, we didn't want to seem like we were just waltzing into their system and saying, hey, guess what, we're going to fix this. Instead, a lot of time was put into building relationships, learning how the staff work, understanding what their challenges are, and letting them get to know us so that we could begin a trusting relationship. But now we had to turn our face toward how are we going to create this trauma-informed strategy. And what we did first and foremost was develop a trauma-informed content assessment rubric. And basically what we really needed, we needed to create some kind of framework so that we could go ahead and assess all this content we were looking at. We came up with guidelines to be accessible, actionable, accountable, accurate and comprehensive, trauma-informed, and respectful. So with those ideas in mind, we gathered 134 pieces of content. We took it from intake sites, from outreach centers, from emergency housing and the OHS administration. And for every piece of content that we looked at the source of the content. We noted what channel it was in. Is it digital? Is it a phone recording? Is it a flyer? What is it? We marked who the audience was, what step in the process, the journey that participant takes in their search for a roof. What step in the process is this artifact for? And what's the goal of this artifact? And we wanted to have a numerical system, so we scored. What we did was, first of all, consolidate, because all of this, I should say, was done within what, like 8 weeks? It was a short amount of time. So we had to kind of condense and combine where we could. So in terms of scoring, we consolidated our criteria to be accessible, so that everybody can reach it, actionable, so that I know what to do once I get this piece of content, respectful and trauma informed, making sure, number one thing, don't re-traumatize the person, understand where they are. And what we did was apply this rubric to various pieces of content. This is an example. This is an example of a form used by the City of Philadelphia. It's a request for an appeal to get back into the center if you've been asked to leave. And so just as an example for this piece, we gave it a 5 for accessible, which is good, 4 for respectful and trauma informed, because it was pretty good. We only gave it a 1 for actionable because it doesn't really say like what happens next on here. And remember, if you're in a traumatized state, just think back to any time that you have felt that way. You want to know what you're supposed to do more than anything. And this form did not provide that. So the process of us creating our strategy started with getting insights from staff and participants, interviews with content creators, conducting that content audit, and also learning from Dr. Megan Corrado, who was our consultant on this project and an expert in trauma, learning best practices around trauma-informed content. This helped us generate recommendations, which I'm about to tell you about. And then we would go on and implement those. Tamar and her team would implement those. One of the things that was really helpful to us was, and one of the really kind of cool things about working with service designers is they had already created a service journey, which you're looking at right here, starting from when you learn about service or get referred and ending with arriving at emergency housing. So what we did was we looked at this journey and we, with the help of the service designers, identified the key points in the journey. And for each key point in the journey, we made sure that there were 3 different pieces of information that could be given. For example, just take the first one, to learn about the service or get referred, there's a referral 1 sheet so that I can hand you a piece of paper, you can walk away with it, you can understand what some of your options are. A messaging checklist, and that was for the service provider to make sure they hit all the crucial points of what they needed to tell the person. And we made sure that there was accurate information on the City of Philadelphia website, because that wasn't always the case. So if you look at each of these key points along the service journey, you'll notice that there's 2 or 3 or even sometimes 4 different formats of information. And that's to help increase the chances that the participant will resonate with one of them at least. Next. So some of the stuff that we thought about, of course, the OHS couldn't do every single thing we thought of, but what we really wanted to do was to give them choices, to be respectful and let them tell us what was going to be most helpful for them. So what I'm going to do now is just run through some of the choices, and it'll give you sort of a sense of what trauma-informed content looks like in the wild. One thing we recommended was resource organization. When you walked into access centers, you would sometimes find walls papered with flyers, and it was very difficult to understand what was official, what wasn't official, you know, what were things about, and it was very easy to worry that you were going to miss something. So one of the basic, very basic, doable recommendations we made was that they organize their resources. And this picture here is just a sense of, you can see in this waiting area, everything is organized. We talked about creating guides. What you're seeing on the right there, welcome to the VA. The VA does a really good job of creating resources for its patrons. And so for a person to come in, need to access service and be able to have something that they can take with them, that they can look at again, maybe when they're in a calmer place, we thought would be an important innovation. Video project. The team at OHS was very into this idea of having an explainer video, because this is as much for the staff as for the participants, and the staff have to explain and re-explain and re-explain the process to participants as the day goes on. So one of the ideas we came up with was a video project, an explainer video that could be played once every 90 minutes, say, so that people could see the journey, the path, and what needed to be done without a staff member having to come on and keep repeating themselves. Plain language forms. There are a lot of forms involved in OHS and in getting help. And a lot of the forms are written in legalese, or they're just written in very dense language. So one of the things we recommended and suggested were plain language forms. Where possible, rewriting forms so that they were in plain language. And if they were legally obligated to use this language that's more, legalese, we recommended creating a cover sheet that said in plain language basically what the form said and basically what it was about, to help people so that they understand what they're signing. And we came up with the idea of one-pages for prevention, diversion, and intake and after-hours services. This is another example of a one-pager done by the VA. And again, the idea is that it's really hard to be and to absorb when you're in a sense of trauma. So being able to walk away with something in your hand and look at it later, or remind yourself, or get that detail that you forgot is really important. Wayfinding signs. As we've talked about before, the access centers are, they're repurposed buildings, right? And they're old and they have narrow hallways. And one thing that we felt was really important was that this become clearer by using signs. So here's an example taken from, this is not the Office of Homeless Services, but as you can see, it's a sign there that sort of tells you exactly what's happening, where it's happening, where you are, where you need to go next. And we recommended that signage like this be placed throughout the access centers. We also don't want to forget about the staff. Granted, all of these improvements should, in theory, help the staff have a less stressful experience, but we also advocated that some kind of safety plan, help, or training be instituted for the staff so that they could have something to refer to when they were stressed out. This one was made by Dr. Megan Corrado, and it's a place where you write down the people, the places, and the things you can do and go to for when you're in a traumatized state. We also created a governance system for them. We knew that whatever we did for them, they're very, very busy, very understaffed. Whatever changes we were going to advocate, we needed to make sure that there was governance in place so that they could keep the changes, keep them alive, and not just simply revert back to neglect, or not neglect, but not having time to keep things up. We also recommended creating checklists. When you think about the people working in the access center, you don't want to tell them what to say. Nobody wants to script what these workers have to say. But the idea of having a checklist so that the persons working in the different positions could make sure they'd hit all the right points that they were supposed to hit, is a way to also just kind of take a little bit of stress off of that person. They know they can check their list. They're not going to forget anything. They're going to be clear and complete. Throughout the access center, in addition to those big wayfinding signs that I just talked about a few minutes ago, we also recommended creating templates for smaller signs and for directions. Again, what's such a big deal about that? Well, templates would mean that the signs all looked similar. And it's reassuring to know that I'm looking at an official sign. This is where I'm supposed to be. This is official information. This can be very calming. We also recommended that they revise some outgoing phone messages. Participants' names go on a waiting list, and they have to call in periodically to make sure that they're still on the list. But the way that the phone messages were, it was very unclear whether the participant was supposed to call every single day or if they just call once and wait for a call back. So we, again, recommended new phone messages that were much clearer so the person would know exactly what they needed to do and not be worried that they were somehow missing out on an opportunity. We presented our strategy and all of those recommendations to OHS so that they could decide what projects they wanted to pilot. And Tamar is going to talk to you about implementation.
Thanks, Claire. Yeah, so Claire and Arin did an incredible amount of work on the front end of this project to really think about, work with OHS to think about what were the needs, what were the options, and then presented them to OHS. Then I kind of took it from there and did a lot of the implementation work. So I worked in a team with the lead content strategist, Jean Adamson, with Dr. Megan Corrado, our trauma-informed subject matter expert, with Liana Dragaman, who was the director of the project, with Devika Menon, who is a designer researcher, and with a lot of OHS frontline staff, supervisors, and leaders. So it was a big team of people all working together. And this was a time when we really had to collaborate on creating the content, which can be the fun part and can be very challenging. So this was our process. I would write a first draft based on the research, and would get it edited by one of my peers. Then we would get feedback from OHS leadership. We would do a rewrite. That would be the time that we did the very first draft of design. A lot of the design for the resources that we created had to be done in Microsoft Word. So that was a big design challenge for Devika, who was our designer. We got feedback from OHS leadership and frontline staff at that point after we had a first draft of design and content. Then we got feedback from our trauma-informed specialist. We would rewrite again. We would have a final internal review. Then OHS would have a final review. And at that point, it would be sent for translation before it would be printed or published. And that translation step is really important, both for accessibility, but also because it means that once we translate something, we can't just really easily edit it without having the translation be out of sync with the original. So we really wanted to make sure that once we got to the translation phase, the content was good to go, and we were ready to literally print it on paper. So what did we make? We made 8 one-pagers. These are the kinds of things that you might get when you enter into an access point, or if you go to an access point and you don't get a bed in a shelter for the night, then you can be sent to emergency housing. And so you'll get a one-pager that tells you what to expect at the emergency housing site. We rewrote 4 forms in plain language, and we also redesigned them so that they're easier to use. We wrote the outgoing messages for 7 different phone messages so that it was easier to understand what to do, and they were more trauma-informed. We created a service page for the website, and we created more than 100 signs for the access points. So these are just some of the examples of the before. On the left is something that you would be asked to sign if you came to an access point, which basically says that you're okay with being added to OHS's system that they use to track people who receive services from OHS. And on the right is the closest thing that they had to a one-pager. Basically, we don't have room for you in a shelter tonight, so these are some other places that you might try. This is what people were getting before we implemented our work. So this is the after. These are some of our one-pagers, so the kinds of things that you might receive when you arrive at an access point. If you're asked to leave an access point, there's a one-pager that explains what your options are at that point. And this is an example of a one-pager about one of the emergency housing sites, which gives really important information for people about what you can bring into them and what you can expect when you get there. These are some of the forms that we created. So the declaration of homelessness basically is something that is needed so that the city can say, okay, this person is experiencing homelessness, we're going to help them out. That needs to be signed. So we were able to make a really clear form for that. And then on the right, you can see the cover sheet that we added to that form that you saw before. And the idea is basically we couldn't change the text on that form because it was legally mandated, but we could add this cover sheet, like Arin and Claire said, and that allows just as a much clearer explanation of what you're signing on the next page. The Office of Homeless Services also has a prevention office, and that in prevention, it really is there for people who are right on the brink of homelessness. It's much cheaper actually for the city to help people before they become homeless than after. So if someone is maybe about to be evicted, they may be able to go to the city, to the Office of Prevention Services, and get some money so that they don't get evicted. And if you do that, you'll meet with a worker, and then you'll be asked to provide some documentation before they can help you out. And on the left, you can see the checklist that you would be given, and you can see that it's kind of confusing to look at. And one thing that's interesting is that different people have to bring in different kinds of documentation depending on their circumstances and the particular reason that they need help. So we were able to create a form where a worker would be able to just check off the specific items that a person needs to bring in, because not everybody needs to bring in everything. These are some of the signs that were in the access points before we implemented our work. There were a lot of signs in these spaces, and something that was we noticed was just the way that you kind of totally might tune out ads on a website. You're kind of trained your brain not to pay attention to them because there's so many of them. That was happening in these access points. There were a ton of signs, and they really kind of, people just ignored them. The information on them was often inconsistent and also just kind of too much for people to take in. So we created new signs, and the signs, I mean, they just make you feel so much calmer to look at them. And you can see that we were able to condense so many signs into just such a small number. This isn't all of the signs on this slide, but we were really able to condense a ton of content into very small signs, or not small in size, but small number of words. Condense the content. Once we had all of these new pieces of content in different ways, we tested them. We didn't just like roll them out with nothing. So these are the signs. We created prototypes of the signs just on paper and brought them to the spaces to figure out what would be the best place for them. Were the sizes that we were thinking about the right sizes? And just the prototypes made people so excited. This is a picture of the security staff helping us to hang up a prototype. And we just wanted to make sure that this was a good place for it, that it made sense. We were planning to take it with us, and they were like, why are you taking that away? It's so good. They wanted to just keep the prototype as the sign. We were like, we're going to give you something way better than this. But that was the level of enthusiasm that we met with, which was really great. After we had all of these new resources, we then, each access point had a meeting where the director of that access point met with all of the staff, including security, to talk about all of the different new resources that we had and how everything was going to be implemented. So everybody was on the same page, everybody knew. And what was nice about it is nobody there was hearing about this for the first time at this meeting. They had seen us around, we had met with a lot of them. Sometimes they had looked at some of their resources and given feedback on them multiple times. So they knew this was coming, and they could feel excited about it because they had been a part of the process. So what were the overall outcomes? So this work was just a very small step in an overarching change that the Office of Homeless Services is working on. For participants, the outcomes were they are experiencing a lot more plain language in all of the services that they might get from Office of Homeless Services. They were experiencing a much more consistent experience at different sites. So because the sites are in different places, in the past, you might have had a very different experience if you went to Appletree than Roosevelt Darby. And this really allowed us to even the experiences out. There was a lot more consistent information in multiple channels, and we were able to make choices clear and empowering. And for OHS staff, this was also, we think, a really great thing for them. There were more resources to support their work. This is really huge. Like, they don't necessarily have to say the same thing 30 times because somebody has walked in the door, received a one-pager, and when they're finally sitting down to work with someone from OHS staff, they know what to expect from that conversation and they're ready. It also clarified processes for them, and that empowered them in a lot of ways. So that is our work for OHS. I think we're all really so proud of that work. And I have been thinking about that work nonstop recently because it feels like trauma-informed content strategy is like the thing that I wish everybody knew about right now in this moment, during and after a pandemic. Obviously, we're not after, but I'm thinking ahead. So I just want to acknowledge that I think that when we started thinking about a trauma-informed content strategy, we were imagining, like, if in some cases you may be working on content that you know is going to be experienced by people who are experiencing trauma, like at OHS, or maybe if you work in a hospital, if you're writing content for a hospital, or if you're writing content for a rape crisis center, there's people who have experienced trauma obviously all over the place all the time, but there's some places where it's going to be more prevalent than others. Well, that day is gone. Now there's just trauma everywhere. There's COVID-19 trauma that can come from job or income loss, losing access to food or shelter, losing access to your support networks, obviously mental health and depression issues that lots of people are experiencing right now. It's very traumatic to experience a life-threatening illness, even if it doesn't affect you greatly, but obviously, certainly if it does. Lots of people are really thinking about their fear of dying a lot now. And of course, the death of a loved one can traumatize a lot of people. I mean, it is pretty traumatic. So how can we, using our content, help people to resist re-traumatizing people when they're looking at content that we create? So the first and most important thing is clarity. The most valuable gift that we can give people with content is to be clear and concise. And I think that a lot of us have experienced a lack of clarity around a lot of things during this time, and that is something that really makes people feel panicked and less secure. So the more clarity that you can give, the more that you build trust, and the more that you allow people to settle in and really take in what you're giving them. It's really important to be goal-driven with choice. A lot of times, especially in the world that we're living in right now, there aren't a lot of options for people. But if you have options, present people with the options. And if there aren't options, make it easy for people to opt out or leave and continue later. So a form where you can't save your progress online and come back to it another time, that's not trauma-informed. Give people an opportunity to check out when they need to check out, both because now lots of people are working with small children in their homes. That's not necessarily traumatic, but it certainly can be. And it's also just distracting, but also because you don't necessarily know what's going to trigger someone else's trauma, and giving people an opportunity to step away and come back is an incredible tool to give someone. And most importantly, you want to be safe and respectful. So you want to explain how. Arin talked about explaining the why. Now we need to explain how we're keeping people safe. And we also have to respect that people have different needs and responses to trauma, and be understanding around that. Thank you all so much for your time. There's obviously lots more to say about trauma-informed content, especially in these times, and we're excited to hear from all of you and hear your thoughts.